I'm like 15 seconds is only my heartbeat. 30 seconds, I can't hear anything. 45 seconds, I'm in my mind, I'm like, okay, I can obviously tell them that, yeah, this person has passed away. You guys, 60 seconds, no heartbeat, nothing. I'm like, I'm not trying to tell her that, yeah, the person has passed away, confirmed. I'm like, hi guys, welcome back again to my channel. My name is Tim Lulua and I film book reviews, movie reviews. I talk about godly, inspirational and good content, and I also share about my nursing journey. If you like this video or if you're interested in the things that I talk about, please click the like and subscribe button and also share with your friends and people that you know. And if you're a returning subscriber, thank you so much for joining me again. So today I'm just here to gist about my nursing journey so far. It's been last year November 6th I got my email from SRNA. I'd written my English exam November 5. So I got in my email that I was successful, and yeah, I have license. I can already start to practice as a registered nurse in Saskatchewan. So it was really cool stuff. I really enjoyed it. I mean, I was really happy about it, rather not I really enjoyed it. So I'm just here to talk about my nursing journey so far. I don't even know whether it's reflection or lessons, but just share really how nursing has been for me. The number one thing is like independent practice. You are now very independent. Nobody's moving around you like the way your preceptor would be or your nursing instructor would be. Like, you don't have any of that anymore. You're responsible for knowing what the policies, what the procedures are, how to do the right thing. You're absolutely responsible for that. Two, whenever you are in doubt, always ask questions. Especially if you're in a medicine unit, always ask questions. Don't ever feel bad for asking questions. Double check. I think I have this correct, but can you check this for me and make sure that I'm thinking the right way? It doesn't hurt to double check. It is better to double check it's better safe than sorry, than to go and make any mistake. Because now you need to always think at the back of your mind, I have a license to protect. So that's that. Other one is you're a bridge. As a nurse, you're a bridge. Doctors are coming to you, occupational therapists, physical therapists, social work, everybody, spiritual care, everybody or almost everybody is coming to you. So you're like the connecting bridge. You're the one who stays with the patients like 24 hours, because if you have 12-hour shift, then you're with that patient, on that unit. Doctors will come, they'll go. This will come, they'll go. But you're with that patient. You're the one who pretty much knows the patient. Families coming to you for questions, like everybody. You are really the connecting bridge. So you have to keep that in mind, that you have to be in how do I call it? You have to be in sync with everything that's going on. Number 4 is dealing with deaths. Guys, I think I've had about 2, 3 or 4, I don't know. I shall know. I've had about more than 2 deaths, and most of them are expected. Like, we know that, okay, they're passing away, there's really nothing we can do for them medically, let them just go, but usually when somebody passes away, you want to listen to the heartbeat for like 60 seconds and see if they take any breath or any heartbeat. So I remember one of the nurses calling me and be like, oh, Timmy, can you just go check with me? So I go in there, I'm like, okay, cool. 15 seconds. I mean, clearly I'm sure, like, if she has called me to come and check, she has assessed and known that this person has passed away, so I know that this person is dead. So I'm listening, like 15 seconds is only my heartbeat. 30 seconds, I can't hear anything. 45 seconds, I'm in my mind, I'm like, okay, I can obviously tell them that, yeah, this person has passed away. You guys, 60 seconds, no heartbeat, nothing. I'm like, I'm not trying to tell her that, yeah, the person has passed away, confirmed. I'm like, I hooked. I couldn't say it. I mean, I said it, but my voice was, I was like, what's wrong with you, Timmy? I mean, guys. Oh Lord, no, like, the gift of life is just something. You're just like, wow, this person actually does not have, like, there is no habit. Wow. So I don't know if you ever get used to it. Like, I remember my very first time, this was my patient, and I listened and there was nothing, and the family members at the bedside, and I didn't even know how to say, like, tears almost came to my eyes. I didn't know how to say that, yeah, their family member had actually passed away, and it was expected that their family member would pass away, but I just couldn't still even bring myself to say it. So there's that with it. I don't know if you ever get used to it. Some people say you get desensitized, but as at now it still hits me a little bit. I don't, if it's not my patient, I don't really cry. And then sometimes, most of the time, I've not seen them go from speaking and go downhill. I've just seen them knowing that their comfort care, they're about to pass away, and they're always quiet and not really saying lots and stuff like that. But I don't still, yeah. So I don't know. I don't know if you ever really get used to it, but I'm still always like, okay, they're dead. They passed away. Like, it still have, like, before the words will come out, it's almost like they are hanging here, and then they will not eventually come out. I would just have to push it out of them. Like, just say it. It's okay. But I would still feel that emotion of, wow, this person is gone. The other thing is, when being with patients at different types of diagnosis, when doctors, like, when they're doing all the procedures or the tests, trying to figure out what's wrong with this patient, and eventually being like, okay, yeah, this is what's wrong with this patient, having to hold the hands of the family through it can just be another different ball game. Some people will start crying when you're like, assessing them, and just, what do I do? What do I do? What do I do? What do I see? Because if somebody just had a new cancer diagnosis, I can't say that you would, you'll be fine. Because how do I really know? It's sometimes you're just like, please don't let this person cry. Please don't let me just be here when the doctor wants to say something, just wants to give them bad news. I don't. You just be thinking that. Anyway, so there's that. Working with people, there's some people you like working with, there's some people you would not really like working with, and that's okay. That's usually normal. You get along with some people and not some other people. One of the things that I have found that has worked more for me is I usually introduce myself and say, hi, I'm Timmy, how are your patients doing, blah blah blah, and it seems to sort of ease like any tension that might be between the two of us, at least, so that they know that they can approach me and stuff. And the other thing is, you also have to be mindful of what you bring to work. Like, I usually say that like, when I'm coming to work, I'm actually bringing my best self to these people. I'm trying as much as possible not to think about what's going on around me, like maybe something is going bad, like my personal stuff. I'm trying not to bring it to work. So I remember they were so tired, and one of my work my co-workers is like, are you tired? Tell me that you are not smiling as much. And I was like, oh my god, I'm sorry. Because I didn't even realize I was smiling. I was stressed already, so I was just like, I want to do my thing and just like, I don't, nobody should disturb me. But when she said that, I had to pause and be like, okay, be present here. So there's that. Pretty much for me, overall, nursing has been good. I've enjoyed it. I have liked it. I do want to explore more areas in nursing and go even further, pursue more things with the healthcare. So okay, it's been a fun experience. It's been such a learning experience, good learning opportunities for different things that you see. And yeah, well, till I come your way next time, I want to say thank you so much for clicking on this video, watching till the very end. Please subscribe and share with people that you know. I also have an NCLEX video that I will link below. If you're preparing for the NCLEX pretty soon, it would help you a lot. And well, I will see you guys in my next video. Bye.